Hi there, I'm Matt Christensen, the executive editor of the Quad City Times and the Dispatch Argus, your hometown newspapers. I'm here today in the Times newsroom, which is mostly empty because our reporters have been working remotely since the pandemic started. I'm here to talk a little bit today about COVID-19, and like everybody else, we're going through some of the same problems and struggles that people out there in the community are. And we got to thinking about trying to get some experts together to help answer some of those basic everyday questions that maybe you haven't seen yet in the paper or other media. So today we've gathered experts from the Quad Cities who are on the front lines of the fight against COVID-19. They include Dr. Louis Katz, who's the medical disease expert at the Scott County Public Health Department. Nita Ludwig is the public health administrator at the Rock Island County Public Health Department. And Emily Gordon joins us. She's a licensed counselor at Family Resources. Today's forum is going to be moderated by Andrea Olson, who's executive director of the Ideas Factory, a consulting firm in town that helps folks get big ideas out like the ones we're going to talk about today. I hope you enjoy the forum. It's a town hall style, and the questions are taken pretty much directly from folks like you. They're going to include information about whether it's safe for my kids to attend sleepovers, or is it safe for me to go visit my family? Questions that we know you have, and we're happy to provide answers to. To make it a little more digestible, we've broken the forum up into two 20-minute segments. We hope you enjoy both. Thanks for joining us.
So thank you so much, everyone, for joining us today. And you know, the community has so many questions about COVID-19, and it's great to have some local experts here to answer some of these community questions. So the first one that we really want to dive into is what is the best way to protect myself and my family from acquiring or catching COVID?
So the best way that we have been saying for many months is to wear a face covering when you're out in public. Of course, good hand washing, wash your hands with soap and water for at least 20 seconds. And use hand sanitizer when you cannot do that. And make sure to keep your distance at least 6 feet between yourself and others whenever possible. Those are really the best tools we have right now without a vaccine to limit the spread of this virus.
Sure. Dr. Katz, anything to add to that?
The only thing that I would add is if you look at the experience in, let's say, China and the European Union, those simple interventions applied diligently worked. And those places have been able to safely reopen in substantial contrast to the United States, where we haven't been diligent and reopening has been associated with surges even beyond the rates we saw in March and April.
Oh, definitely, definitely. You know, but people have questions about just the everyday as well. And one of the community questions we have here is as simple as, is it safe for my kids to attend sleepovers?
Sorry. Every family is going to have to make their own decisions about a lot of these things. And I think discussing what needs to happen is key. So that might mean you have some sort of more structured family meeting or just some basic communication around what's going to happen with the people in your household and other support people that you might be around. And I think you want to talk to kids at an age appropriate level about what is occurring, because kids are super aware of our anxiety when it's happening, right? And they're going to internalize that. So if we don't tell them what's going on, they're going to think something worse is happening and not know what kind of control or autonomy they have to keep themselves safe. I think the other thing that we have to kind of expect is that children are going to act out because their routine is totally disrupted. Everything that they're expecting is different. They're going to have some anxiety over all of this. So I think you have to kind of acknowledge that and expect that, and not give in on all kinds of things just because kids say that they're unhappy. Because obviously all of us are unhappy with a lot of what's going on right now, but that's the reality.
Oh, sure, sure. But, you know, I mean, with all these changes, some children are afraid to go back to school. And what should parents be talking to or telling their children about going back to school?
Well, I think you want to talk to kids at an age appropriate level about what's going on, and kind of make sure they know the basics of what danger is and how they're going to keep themselves safe. You talk to them about safety in all kinds of other areas, so you would certainly talk to them about safety here. I mean, I don't put a child in my car and not let them buckle their seatbelt, so I'm not going to let them leave the house without their mask or come back in the house without washing their hands. So I think you just kind of figure out how to help them keep themselves safe and also reassure them that the adults in their lives are really trying to keep them safe. Is another important piece, I think.
Oh, definitely.
I think it's legitimate at a certain age for the kids to be told and to understand that even if they get infected, they're unlikely to get very ill. There are rare occasions when that's not true, but the large majority of kids under the age of, school-age kids, K through 12, don't get very sick at all, and that our concern more centers on their ability to give it to somebody else than that they're going to get terribly sick. In a certain age, maybe it's 4th, 5th, 6th grade, those messages, I think, can be tailored to their understanding.
Mm-hmm. Nita, do you have anything to add?
Sure. I would just add that all the school districts with this upcoming approaching school year are working very diligently on their plans. They're consulting public health officials, and they will be working very hard to make sure that the school environment is as safe as it can be and following all the guidelines that's given.
You know, speaking of those guidelines and processes, one of them is surface cleaning and making sure things are decontaminated, if you will. So should people be wiping down packages that come into their home? What surfaces should they be really active in continuing to sanitize and clean?
If they sanitize their hands, the need to wipe down packaging probably becomes much less. But high touch areas, recommendations for disinfection are pretty clear. So horizontal surfaces and door knobs and I suppose light switches. I use my pen on the elevator buttons at the health department so that I don't have to, but I always have.
Emily, Nita, other suggestions?
Certainly, I think that, if people wash their hands when they get an item, like Dr. Katz was mentioning, but then after you open the packaging and put the items away, then wash your hands again. You can't wash your hands enough in this scenario.
Oh, for sure. You just don't realize how many surfaces you touch in a day and how many times you touch your own face. If you start to think about it and be cognizant of that, you realize that that's a big thing that you can control, and being proactive about it is important. So, some of our readers also have really deep questions about the COVID treatment and what's it like now to be treated for COVID? What's that process, and how is that experience if you have to be hospitalized?
Well, in the hospital, it's primarily supportive care. The most appropriate ways to keep people breathing effectively, to prevent things like blood clots, keep people well hydrated and nourished. There are a few treatments, specific treatments for the infection that look promising. Dexamethasone clearly, very good data that the steroid drug dexamethasone, when given to critically ill patients, results in better outcome. Less good data on a drug that works against the virus itself called remdesivir. Very suggestive, just not terribly high quality data. But the most important aspects are the things that we do to support patients while they're ill, whether they're in the hospital or at home, during COVID-19, to keep them from deteriorating and having bad outcomes.
Anything to add, Nita?
Sure. The majority of the people that we do talk to when we are contact tracing those positive cases do remain at home and don't need to be hospitalized. The vast majority do recover at home with over-the-counter remedies as well. So that is very encouraging that only about 10% will have to have more serious medical treatment than that.
Sure. And that is good to hear, even though it is a terrible thing to have to go into the hospital, that is a lower number at this point. So, a question that comes up often as everyone gets cabin fever is it okay to visit local relatives? Is it okay to visit a few friends and keep that circle small, or am I putting myself still at risk?
I think the rule that people should consider is you better have a good reason to mix households. So the people you live with, and the risk that you bear is the risk that you bear. People outside the household or family unit, you should have a good reason or the kinds of facilities that allow you to do all the stuff that we talk about doing in public. So since March, my wife and I live on a farm outside of Tipton, and we've had friends over on 1 or 2 occasions, and it is very easy for us to stay more than 6 feet apart and in the good weather outside. So we can get away with that. But I think bringing people from outside your household unit into the household, particularly in enclosed spaces, you better have a really good reason before you take that risk.
For sure. Emily, Nita, anything to add to Dr. Katz's comments?
I just think you need to be really planful, because support systems are super important when you're dealing with the level of stress we have going on right now. I mean, everything is free-floating anxiety in our world right now. Not only are we in the middle of a pandemic, but there's a lot of civil unrest and other crazy, overwhelming things happening. So I think you have to take care of yourself, and that means accessing your support systems, but that means doing it in a way that's safe. So that means exactly what Dr. Katz said, that you're going to be very far apart and outside, or you're going to do so virtually. You're going to call people, you're going to go on social media, you're going to write them a letter, you're going to talk to them on Zoom and have that kind of virtual meetup. So the more that we can do those kind of things, the safer, for sure. But we do have to continue to maintain those relationships. That's the most important way to help yourself cope during a lot of these things.
Oh, definitely. And that begs the question of, how do you stay positively productive and avoid some of those negative coping behaviors that happen when you're under a lot of stress or undue stress?
Drink.
I think that's a negative coping skill, is what she's getting.
Maybe. In moderation. In
moderation is good. I mean, I think you have to figure out a system that works for you, right? For some people, it's going to be different than others. I have been primarily at home for since March 15th, basically. Very rarely do I go anywhere for anything. And I kind of just have a routine that works for my life. Like, I walk the dog, I do things like that. I go outside for some things, but I really focus on intertwining some of that self-care and making sure that I'm able to have those positive skills scheduled so that I don't fall into habits of only leaning on not so positive coping skills, because we all have coping skills, just some of them are not so positive. So we have to figure out how to fill our time with the ones that are really going to be effective in helping us take care of ourselves in the midst of all of this.
Sure. It's an opportunity to learn something new, whether that's be yoga or Pilates or, I've seen people say, I'm going to learn a new language. I'm going to use that time productively. And that's my way of coping, is to stay busy in a positive way. So it definitely varies from person to person.
Yes, it's very individualized. I also think you have to be able to give yourself a break. Like, you shouldn't assume you're going to, reorganize your whole house, because it still is really stressful and you're still living your life, right? Even if you are trapped at home, that doesn't mean you're going to suddenly become a totally different person who organizes their spices or whatever the heck it is. So I think
right.
Break. And know that it's okay to, make mistakes and not get it quite right that first time.
Oh, sure. Oh, definitely. So, though, for those people who aren't working from home, they're working from an office. And let's say that office doesn't require masks. Maybe they're encouraging social distancing, but people aren't wearing masks. How can an individual who has to go into the office stay safe, in that environment?
Well, I would say for that person, even if it's not required to wear a mask or a face covering, you can still choose to wear a mask or a face covering. You can still keep yourself safe by staying 6 feet apart from others around you whenever possible. And of course, continue washing your hands every chance you get.
Definitely. As my mom says, don't touch your face. Don't touch your face.
Okay.
So, speaking of that and physical and personal interaction, is it safe for kids to play sports? Sports is coming online right now with MLB and NFL and NBA. And how do you balance your child's health and involvement in group activities with this COVID crisis going on?
Well, Illinois Governor Pritzker has just put out new guidance for youth and recreational sports. So there are different risk levels depending on what kind of a sport it is, if it's outdoor, if it's able to have social distancing, those sorts of things. So I would definitely check out those guidelines in whichever state you're in. But again, it's going to be a personal decision on the family's part to decide what level of risk it might be to do these type of sports, and if it's really a good idea at this point in time.
Playing tennis is one thing. Being on the offensive and defensive lines of a football team, 1.5 feet apart, breathing on each other is another. So it depends on what you're talking about. I would point out to people the experience that's developing pretty rapidly in Major League Baseball. And it's not, those people are living in a bubble with levels of testing that aren't occurring in the real world. And things seem to be falling apart a little over the last several days. So once again, how do we define essential activities? And that's a hard one. But I think the default position should be skepticism about things that bring lots of people together, close to each other. We're going to learn a lot from Major League Baseball and the NBA. These are they're very controlled environments, much more so than I think high school and college athletics so far. If we just pay attention over the next week, 10 days or so, we're going to have a much better idea in those areas what looks like it's safe and what isn't. On the other hand, PGA Tour is going up pretty much without a hitch. And I think tennis probably could do the same thing. People are far apart. And if they maintain that, there are things that ought to be safe.
Yeah, it sounds like part of it is the nature and structure of the sport itself, and
Right.
whether that's close contact or by structure, it's not. And there's a difference between those two. And one of those, what we're talking about, critical activities or essential activities, and one of those things is church going, and faith is very important to a lot of people. And can people still stay safe while attending church services, since it's an enclosed space and people tend to be closer together?
Well, church services since March, we have very much encouraged church services online, Facebook Live, some kind of virtual platform if and whenever possible. I know some churches have done even drive-in type services, and some have now opened their doors to at least partial amount of their congregation and trying to sit people just with their family and then at least 6 or more feet apart. Again, that's a personal decision on if you want to take that level of risk to go in person to a service, but we are still really encouraging and recommending virtual or online type of services.
Yeah, I think the risk that I'm willing to take for myself is one thing, but when I get infected, there's an interval before I get sick, or if I may not even get sick, when I am perfectly capable of killing somebody else. And I've reviewed the sacred writings of the Jewish faith, and there's nothing in there about having to be there in person to pray. So I discourage it. I discourage all mass gatherings as much as I can get away with it. I think it's particularly indoors, not appropriate at this point in our community where we have substantial uncontrolled community spread. So generally speaking, when people ask me, can I open my church? My answer is, I wouldn't.
And I think it points to what you talked about earlier, Andrea, that this is a chance to like learn how to do things differently and learn something new. And it's not the same way we've always done it, which is hard to adjust to, but there are other ways that we can access faith and spirituality and make sure that we're kind of meeting that need.
Mm-hmm. Definitely. You know, and that's the thing. There's a difference between indoors and outdoors. And, you know, being outdoors is a whole different scenario. And can I exercise outdoors? What about, you know, games like pickleball? I know, Nita, this is one of your hot topics. So tell us about it.
Well, this really during this pandemic was the first time I ever heard about pickleball. It's sort of like tennis on a smaller court, from what I understand. And I couldn't find pickleball in the governor's list of sports, but tennis is a lower risk activity. You're a little bit farther apart, usually outdoors. So I think the risk is relatively low. And certainly outdoor exercise is recommended for everyone to get fresh air and sunshine, and for mental and physical health as well.